Hi, I'm Dr. Lindsey Cilia, an interventional cardiologist at Virginia Heart, and I'm going to be talking to you about the diagnosis and treatment of coronary artery disease. Coronary artery disease is the most common form of heart disease in the United States. It's a condition in which the arteries that supply blood to the heart muscle become narrowed or blocked due to buildup of cholesterol-rich plaque. This plaque buildup can be caused by high blood pressure, diabetes, smoking, obesity, physical inactivity, family history of heart disease, and aging. The reduced blood flow to the heart can lead to chest pain or pressure, shortness of breath, heart attacks, or even heart failure. The first symptom to look out for is chest pain or pressure, often with exertion or stress. You should also watch out for shortness of breath, especially if it occurs during both exertion and rest. Lastly, be aware of any discomfort in the arm, neck, jaw, or back. Some patients, especially women and people with diabetes, may have more subtle symptoms. It's important to stay proactive when it comes to your symptoms and not wait to schedule an appointment. Cardiac catheterization refers to a set of minimally invasive non-surgical procedures designed to assess for the presence and severity of coronary artery blockages and to check fluid and pressure levels in the heart and the lungs. Some terms you may hear are right heart catheterization, left heart catheterization, and coronary angiography, all of which refer to a different component of the same cardiac catheterization procedure. Percutaneous coronary intervention, which we call PCI, refers to any non-surgical, minimally invasive procedure used to open blocked arteries and restore normal blood flow to the heart muscle, either non-urgently in the presence of angina or urgently in the midst of a heart attack. The procedure is performed through a sheath, which is very similar to an IV, most commonly placed in your wrist or your groin. PCI encompasses other component procedures you may have heard of as well, to include balloon angioplasty or stenting, which is the insertion of a tiny expandable metal scaffold to keep the artery open, and atherectomy, which is the actual removal of plaque from the arteries. With new treatment advancements, more complex coronary artery blockages are now able to be safely and effectively treated with minimally invasive non-surgical interventions, and most are same-day outpatient procedures. On the day of the procedure, you will be sedated. You will lay mostly flat on a padded X-ray table. A sheath will be placed with local scan anesthetic in a small artery, either in the wrist or through the groin. Through the sheath, a small flexible tube called a catheter will be advanced through the arteries into the heart. Continuous X-ray images, called fluoroscopy, are taken to identify the coronary artery blockages. If needed, as mentioned previously, small wires, balloons, stents, or other equipment can be delivered through these small catheters to treat the blockages. At the conclusion of the procedure, the catheters and sheaths will all be removed and light pressure dressings applied to the access site. Afterwards, your medications will be adjusted as needed, and you will meet with your provider to discuss a long-term treatment plan to help keep your stents open and prevent development of new blockages. The Virginia Heart team remains at the forefront of coronary interventions, continuously incorporating new skills and technology to benefit our patients. Our physicians are leaders in the field, performing high volumes of the most complex procedures with outstanding success rates.